Namaste, I am Dr. Anurha Panda, Laparoscopic and Robotic Surgeon working at Apollo Hospital, Jubilee Hills, Hyderabad. What is uterine prolapse? Uterine prolapse means something coming down or sagging. When you say uterine prolapse, it is the uterus which comes down, descends down. It may come alone, or you may have a bulge or the bladder or in the rectum. So, it may be associated with a cystocele when the bladder is affected, or a rectocele when the posterior part of the pelvis is affected. What causes a prolapse? So, most of the time it is the weakness of the pelvic floor muscles, which can happen with age, which can happen with decreased estrogen. It can happen if somebody has more number of children, difficult deliveries, and it can happen if somebody has chronic constipation or chronic cough. So, those are the things we should keep in mind, or somebody post delivery has a very a difficult delivery and gets active and starts doing lot of vigorous activity. Even that can predispose to somebody having a prolapse. So, what happens? What is the symptoms? You have these older people coming and telling us they feel a bulge or they feel heaviness in the vagina. They feel that they have difficulty in passing urine, they have to push something in to pass urine, or while passing motion is difficult and then they see a bulge. These are the usual symptoms what we find. So, what is to be done? Well, first is prevention. Post delivery women can do the Kegels exercise with proper biofeedback, prevent constipation, prevent cough, and then whenever they have mild prolapse, all prolapse will not require a surgery. Many a times you can do this Kegels exercise or pelvic strengthening exercises and things can be more or less managed. But when they are symptomatic, or a woman has recurrent urinary tract infection because of the prolapse, or she has difficulty in passing motion and every time it comes and rubs there and she has difficulty, then is when we have to operate on them. The older women presents to us, we tell them to remove the uterus and then repair the cystocele, rectocele, and suspend the thing so that they don't get a vault prolapse. But many a times when a younger woman comes, she is desirous of keeping the uterus, even that can be done. The uterus can be fixed up. That is what we call a hysteropexy. We fix the uterus up either from below to the sacrospinous ligament, or a colpopexy from above, and then she can have the uterus and she can even have children, but it can again prolapse. So, most of them will end up with a caesarean section. That has to be understood. Or when it is a very frail lady, sometimes may not be fit for getting a surgery done, then we put a ring. It is called a pessary, a ring pessary or other pessaries which is available, which can just push the uterus in and it stays there if somebody is unfit for anesthesia. So, it depends, you have to consult your doctor when you have a prolapse, if you can go with exercise or putting a ring, or you will need a surgery with uterus removal or with uterus preservation. Thank you.